Okay.
And you want me to call Devendra?
I can do it. So just
No,
remind.
I'll call. I'm not on the phone, on the iPad, so I can call. Let me call.
Oh, we've got a new student today, looks like.
Oh, join us, Kian.
Aha, Kian, say Jai Jinendra.
Jai Jinendra.
Good to
You
see
gonna
you
join the
always.
class? Oh, she just pressed on to no answer. She stopped the call, so maybe she's trying to join.
By the way, we added up, we've got 15 diseases. It's quite amazing.
Jai Jinendra, everyone.
Okay, there.
Jai Jinendra, Devendra Bhai.
Jendra,
Everyone.
Good. Not coming tonight, coming tomorrow?
Tomorrow morning.
All right.
Hello?
Devendra, are we also going to cover Alzheimer's and Parkinson's or no?
No, we left those two.
Okay.
We had to cut somewhere.
Yeah.
But I don't think we covered them. We could have, we just, we cut lines somewhere.
Okay. No, I just it was in the news today that Vero Beach is opening a new Alzheimer's and Parkinson's center in town.
Oh, wow. Oh, nice.
And they will be providing services. So thought that would be a good opportunity to go and give
Oh,
a
yeah.
demo or something, offer services.
Yeah, we can quickly do it. It's no problem. We didn't plan on it, but we could do it as an ad hoc afterwards. Another 14 hours thing on that.
It's becoming very common in old age. So
yes, it's an important one. It is one of the big ones. I don't know if we missed it, but we missed it.
Right.
Yeah, so right now it's recording in progress. Okay, so if you want to start it.
Okay.
Yeah.
Samaniji has just texted me to say that she's just trying to join. But until then, she said that I can give some announcements. So this is basically the last lecture that you will be having. The course finishes today. Next 2 weeks is revision. I think you can all see the timetable on the Google Classrooms. So in there, I've got the list, and we're going to be doing 2 weeks of revision, mostly run by the Samaniji. And then the last week is our exam week. So in the exam week, Monday to Thursday, Samaniji is going to have short answer questions in an exam style, which we will be doing at this time, like 8 to 9. Instead of a lecture, we're going to have short answer questions. You'll go straight onto your phone into Google Classroom, and the short answer questions will be there. We have to answer them in this 1 hour time and submit. So I don't know what order it will be in, but the things that she's going to cover in each of them is meditation, pranayama, mudras, mantras, and asanas. So mantras and mudras is on one day, pranayama is on one day, meditation on one day, and like that. So she'll tell us what days each one is coming. So, if you want to do some last minute revision, it's like you'll be able to do that. And then on the last day, on the 5th day, which is a Friday, we'll just do like a closing question answer session if anything is left untouched. And then, excuse me a second. And then the exam itself is going to be from 8 o'clock to 12 o'clock on Saturday, and 8 o'clock to 12 o'clock on Sunday. On Saturday morning, 8 to 10 will be the multiple choice question. And this is going to be got from all the medical lectures that have been given. So it will mostly be, and they'll be very easy. They're not going to be difficult questions, not going to ask you about specific medications or anything like that. It's going to be very easy to understand. And things that you need to know if you were going to be teaching a yoga class for somebody who has the condition. And the next 2 hours is going to be our presentations. We each will have 10 minutes to do our slide presentation to the class. I don't know how order she wants to do it in, but some of you will be online giving the presentation, and some of us will be in person giving the presentation. And then on Sunday, Anuja will be doing the yoga asana exam for those of us who are in person, as well as actually those online will be done. So it will just be those of us who are in person. And they're going to be 15 minutes each. And she's going to make the chits like she did last time, where you pick a paper and you get what you get is what you have to do. And on there will be either 2 minimum or 3 maximum asanas, which she will want you to demonstrate. If it's 3, she said it will be something that flows one asana into another. I think she's going to tell you all this when she comes tomorrow. But basically, this is for heads up for the ones who are doing the exam tomorrow. It's going to be 2 or 3 asanas, and then she'll also have some questions that she'll ask about how you get into the asana, maybe about whether what the asana's benefits are, stuff like that. And then we want to do a graduation ceremony, but we want to combine it with the somebody is leaving. So we're going to be doing it when all the audience comes in Swadhyay. So that's going to be around 2:30 to 4:30. I have to ask somebody exactly what time will be I think it'll be probably at the end. So maybe 3:30 to 4:30, or maybe we'll do it at the beginning. And then that will be it. We'll get a certificate for completion of the course, and you guys will be good to go to teach yoga. I'm Pragyaji. That's
Quick
a scary thought. Yes.
For the presentations that we're doing on that Saturday, do we need to send our slides ahead of time to someone?
It might help to send when you'll be presenting it. We'll just have you on the Zoom, right?
Yep.
So as long as you show the slides on the Zoom, it'll be fine, I think.
Sounds good.
Yeah, I don't think that. Unless I don't know, is Devendra that? Yeah, Devendra, do you think she needs to send?
Compiling a slides for some collection? It may be, if Raki's doing the book together, maybe he may want to put the slides at the back. It'd be nice.
Okay, so send the slides.
Contribution of all of us into that, for the future students. So I think it'd be nice. I mean, you can present and send it before, after, doesn't matter, but it would be good to collect them.
Okay, good. The Samaniji has joined. Vandamino Sami Samaniji.
I hope your journey was safe and
Samaniji, Kutagisi.
So what did you say, Devendra?
I hope your journey was safe, Samaniji, and no problem.
Oh, Samaniji's journey, huh? Samaniji, are you back at the center?
Yes, I am at center now.
Perfect.
Okay.
So you just arrived.
Yeah, because some people came, so I was engaged in that also, and the staff are coming. So now I'm downloading my PowerPoint actually.
So I told Samaniji, I told them all about how
you can make an announcement.
Yeah,
revision classes and the exam.
Right. I think I said most of what we were talking about. And just I was clarifying that the presentation will be during the Svadhyay, the certificate, the graduation ceremony.
Mm-hmm.
Correct?
Yes. Yes.
Do we have a time for that? I don't know if we have a time for that.
We can just one presentation we can just keep for public. Otherwise, other presentations we can take before, or we just a graduation ceremony. We can just give the certificate, and they can share. The participants can share their experience only.
Correct. Correct.
So that will be good. And presentation we will take before.
Yes. And then the graduation ceremony, will we be doing it at 2:30 before the Swadhyay, like when the Swadhyay begins, or at the end of the Swadhyay?
Before Swadhyay, we can, because we have 4 hours, no, in the morning.
Morning, exactly.
Yeah,
And then
so just we can start our presentation from in our time, and during the graduation ceremony, they can just share their experience about the course.
okay.
Yes.
So presentation, Samaniji, yes, okay, that's good. We can see how it works out. Because presentations we can do on Saturday.
Yeah, either Saturday or Sunday,
Yes.
but what is
And
good
if we
for
need
us.
more, we can do Sunday, correct. So that's how it will be. Okay.
Yes.
And did Rameshji have 10 questions also, Naina?
Did Rameshji have any questions?
No, 10 questions also for him.
He's going to submit 10 questions.
Yes.
For the asanas, yes. He's going to send them to Samaniji, and she's going to put them into the Google Classroom or Suruba, whatever. I think I told him to send them to Samaniji. So just when you're making the test, the exams, Samaniji will organize them questions.
Yes. So yeah, the questions we will set in a what we say questionnaire format, and that will be online, or they can take just any time. It means in the given time. So the questions will be set before, and the question paper would be just now. I have to think about all those questions, but Rameshji has shared some of the questions.
Okay.
Yes.
So we can do one.
I
10
will
questions
include
each day.
all those questions. Yes, and the therapy part, especially the understanding of the health issues, whether anxiety or asthma or any other. So the treatment, conventional treatment, which is given in the medical field. So these 2 main lectures which have been given by the doctors, and some researches, the participants can include those researches which have been talked by Dr. Devendra in their presentation. Okay. Questions would be based on the first 2 lectures and then the yoga part. Yes. Okay. So should I start my discussion? Just give me 1 minute, okay? 1 or 2 minutes. I have to check. Okay, now. So today we will discuss about asana, pranayama, mudra, mantras, and meditation to address the problem of depression. So yesterday and day before yesterday's, you might have learned a lot of things about depression. how it is caused, and what is the treatment which is being given even in the field of medical science. And now how yoga, meditation, especially the physical exercise, can also help us to come out of this problem, or at least to prevent this problem. And today we will learn about meditation, mantra, mudras, and also the breathing exercise, along with little bit physical exercise. Okay, so this is the topic, yoga-based interventions for depression, or you can say asana, pranayama, mudra, and meditation. We are discussing all these things as a pressure therapy for all these different health issues. And now we will see that how these asana, pranayama, mudra, and meditation can help us to prevent this problem of depression, which is going on even in the college going young people, and also in the adults, or those people who are under too much stress. They are getting all these mental problems. So you have learned about what is depression. I need not to define it, but the major depressive disorder as per DSM-5 and biopsychological model. So it has been accepted as the major depressive disorder of our mind, or you can say. So here, neurobiology, so dysregulation of serotonin, dopamine, norepinephrine, or HPA axis, hyperactivity, chronic inflammation. So these are the different reasons we can see that they are working behind the depressive state. Somatic manifestations, we see that fatigue, sleep disturbance, GI dysregulation, autonomic imbalance, all these are the outcomes of this depressive state. Why yoga therapy matters for us in this particular problem? So we know that modulates vagal tone, reduces cortisol, improves interoception, and enhances emotional regulation, which are the internal causes of our depressive state. So it is necessary to address all these issues from within, and for that the yoga can help us. Evidence-based for yoga interpretation. So meta-analysis show moderate reduction in depressive symptoms with yoga-based interventions. And there is mechanisms supported by research. So under that mechanisms, we find that increased GABA activity, reduced IL-6 and TNF-alpha, improved HRV, heart rate variability, and enhanced prefrontal cortex regulation. So these are the outcomes which we can see through various studies which have been done, especially on yoga. Clinical populations studied adolescents, adults, perinatal depression and chronic illness. So these are the clinical populations which have been. These are the studies which can we see. Now we can see that what are the physical exercise which can help us to come out of this depressive state. So there are certain physiological rationale behind all this physical exercise. So they improve circulation, blood circulation, stimulate parasympathetic dominance, And because in depression, what happens is the parasympathetic nervous system becomes more active or hyper, and due to that, someone is not interested to do anything in his life, or becomes very pessimistic rather being optimistic and active. These yoga also help us reduce rumination, enhance proprioceptive grounding. So in this way, we can see that this physical exercise are very, very important, especially for those people who are under this depression. Recommended sequences, which is regarded as a medically very safe, and that is that those people who are under depression, they should at least practice Tadasana. It is not Tadasana, but Tadasana, postural element and grounding. So in this, you can see that the body remains completely straight, and we do this practice in a standing posture, keeping the backbone, neck, head all in one straight line. And we try to stretch our whole body so that the stress which is accumulated in different parts of our body, it can easily come out of it. Marjorie Bitley is Bitlasan. So that is a cat or cow pose, you can say. So in spinal fluidity, breath movement, synchrony, these two exercise or physical exercise are also considered very good. Balasana, it is very simple physical posture exercise. And when we practice it, so it makes our parasympathetic activation. In some sense, if somebody is having a hyper, sympathetic nervous system, then we have to make it balanced. But Balasana here, it should be more for activation of sympathetic system rather than parasympathetic. But how it is happening in that way, we have to see. Bhujangasana, it opens thoracic region, counters depressive posture. Setubandhasana improves endocrine and autonomic balance. Viparit Karni, it reduces sympathetic overdrive, excellent for anxiety-linked depression. And Shavasana, mostly it is very well known practice in all other yoga tradition. That's why it is given here. But we say relaxation. Okay, so full relaxation, you can say, or complete relaxation or long relaxation, in which we give relaxation to each and every part, each and every cell of our body. So, and for at least for 30 to 45 minutes. So that kind of a deep relaxation can help us to relax our stress or such kind of a mental state, can help us to come out of such a state. So it is an integration and relaxation, in both, you can say. Clinical notes: avoid intense towards bands in severe depression. So it is necessary, and we have to be careful of all these precautions too. If somebody has some such problems of bending forward, so he should not practice that kind of exercise. Emphasize slow transitions and breath-linked movement. So we should not do any exercise with force or in the painful condition, or if somebody has surgery or some other issues, they have to be very much careful. And we should try to link our own each and every step of exercise with breath, so that our mind can be completely concentrated. And if mind is completely concentrated, the exercise gives very good results and very good effect on to our problems. Now, pranayam means a breathing exercise. And this pranayam can also help us to come out of the problem of depression. So the mechanisms enhances vagal tone. So in this way, the pranayama is useful for us. Pranayama reduces amygdala hyperactivity. It improves CO2 tolerance and emotional stability, which are very, very important for the person who is subject to depression. Protocol for all these particular meditation or breathing exercise. Just we have to be very much careful that we have to practice at least the dirgha shwas, that is long and deep breathing, at least the 3-part breath. It means just you can breathe in and breathe out, and maybe foundational calming breath. If we can hold inside, that will be better for us. So in this way, we can say this is a 3-part breath. Nadi Shodhan balances hemisphere activity, reduces anxiety-driven depressive symptoms. So Nadi Shodhan we have learned so many times, and we revise most of the times. So just you have to breathe in and breathe out through one nostril for 5 times, 10 times, 15 times, depending on your capacity and your interest and time. And shifting to other nostril, we can do this. We can repeat the same exercise. So in this way, if our nervous system or sympathetic and parasympathetic nervous system get balanced by this exercise, then it becomes easy to come out of such a depressive state. Bhramari is a very important breathing exercise. It increases nitric oxide, reduces agitation and insomnia. Because of the depression, people cannot sleep easily, and that's why they have problem of insomnia, and because of that also their problem becomes severe. So it is necessary that they have to sleep, and they have to take very sound sleep, and for that pranayama can also help them to come out of their stress. Ujjayi pranayam, one has to do it gently, and it improves interoceptive awareness. So Ujjayi pranayam is also very good, because whenever we practice Ujjayi pranayam, it creates the sound like the ocean, and ocean sound also gives tranquility and peace to our mind, and it also improves the thyroid and parathyroid function, and thereby sometimes the metabolic disorder can also be improved. So now safety for medical professionals: avoid Kapalbhati or strong Bhastrika in patients with panic-linked depression or hypertension. So we should not go to such a hard breathing exercise, in which someone has to make more effort, or it may be harmful for them if they are not in such a condition to do all these breathing exercise. Mudras for depression. So when we look at the mudras, we find that they are very important. And there is some neuroenergetic rationale behind it. Mudras influence pranic flow, autonomic balance, and subtle emotional regulation. So we have already practiced these mudras, and you might have noted effect of the mudras. They look like very simple things, and we may think that how they can work. But when we practice at regular basis for at least 14 to 15 minutes, especially for our problem, then we can see the results of mudras. Those people who are very healthy, have no problem, might be they cannot note down that what kind of effects they are getting out of the mudras, but those people who have problem, they can easily see that how far they are working for them. So there are certain mudras which we can practice, especially for depression. So the first is Jnana Mudra. It improves clarity of mind, it reduces rumination. Pran Mudra, it enhances vitality and motivation. Apan Vayu Mudra, it calms emotional turbulence, and Hriday Mudra supports emotional release and heart-centered awareness. For practicing, we have to be careful that we have to spend at least 10 to 15 minutes twice daily if somebody has this kind of problem, and combined with slow breathing for amplified effect. So it is very important that if we can connect all physical exercise, breathing exercise, it is already breathing exercise. So just we have to be very much careful of our conscious of our breathing process. It means our mind should be completely focused and concentrated. Then the breathing exercise can be in a proper way, and we can get good results of this exercise. Meditation for depression. So meditation, we know that meditation strengthens prefrontal cortex. It reduces default mode network overactivity, that is rumination, and it improves emotional regulation and resilience. Evidence supported practices are mindfulness based stress reduction, which is known as MBSR, and you have heard about it many times during the course. Loving kindness meditation, it is also known as contemplation or friendliness. So that is metta or maitri, you can say. In Praksha meditation system, we talk about maitri. So maitri or metta is same thing. It is just a Prakrit term, so it is not written like metta. So it means a contemplation of friendliness, or you can say loving kindness. This meditation can help you to come out of depression, because a depressed person doesn't like to talk to anybody, does not want to share his problems and issues with any other, and think just internally about that problem repeatedly without any control, and that's why the problem becomes more severe. But if he becomes friendly to all other living beings, can open his heart in front of other people who are trustworthy, then it becomes very easy for him or her to come out of this problem. So he has to think, he has to practice at least a contemplation of friendliness, that all people are my friends, they are helping me, they are always positive, they are ready to do something what I'm looking or expecting from them. So this positive thinking can help him to come out of this depressive state. Body scan meditation is also very, very important. In Praksha meditation, perception of breath, color meditation, and internal witnessing. These all different practices, they can also help us to come out of this depressive state. Any one meditation we can just practice. It is not necessary that we have to practice all these different meditations all together. One which is most suitable for you or anybody, those who have such problem, they can just focus on one, but take 100% benefit of it by practicing that meditation basis at least 5 to 10 minutes every day. So start with a short durations, 5 to 10 minutes, and go on increasing the time if someone has time, and if it is helping him or her. Avoid unguided meditation and severe depression with a suicidal ideation. Requires professional supervision. So it is necessary that such people should do meditation under some what we say yoga expert or some person, so that he must or she must not have any kind of suicidal thinking during that meditation. So it is necessary that such people should go to the expert and try to meditate at regular basis with them. Integrated daily protocol is that 20 to 30 minutes has to practice all these different mudras, physical exercise, breathing exercise, meditation, and contemplation. So at least 5 minutes gentle asana, which can warm up his body or can prepare his body for meditation and other yoga practices. 5 minute nadi shodhan, so that our bhramari, so that his or her internal system can also be purified or cleansed to meditate properly. 5 minutes for mudras, pran or mudra, at least 2 mudras one can practice. 10 minutes guided mindfulness or praksha meditation, in which relaxation can help him a lot, or breathing perception. Optional, Viprit Karni before sleep. This kind of a mudra can be done before sleeping, and that can also help him to go into sleep. Or relaxation is the best one, but just the person who is under depression, he is not able to do all these things by his own, and there must be some person who can help him. Now, contraindications and precautions. So, severe depression with suicidal ideation requires a psychiatric oversight. As I have said, that such people, those who are having severe problem, they should practice all these things under the supervision of the psychiatrist or yoga expert. Avoid over stimulating practices, rapid pranayama or intense big bends. So it is necessary for them if they have such physical problems or issues. Monitor for dissociation in trauma-linked depression. So it is also necessary, and that we somebody who is giving treatment to in such problems, they have to monitor that how it is working for them, and encourage consistency over intensity. So it is necessary, and that at least a consistency is required. If they cannot extend the time or cannot do for a very long period, at least whenever they are suggested to do some meditation for the time being, at least they have to be very regular and consistent to that. There are case studies can be also done. So for that, someone can make the profile of the patient's intervention plan, and they can prepare for such people. Our measures can be used like PHQ-9, HRV, sleep quality, and clinical improvements, whatever is required, they can just suggest to them. So in conclusion, I would like to say that yoga-based interventions offer safe, evidence-supported, autonomic regulating tools for depression, and works based as adjunct therapy alongside psychotherapy and medical care, and it encourages self-efficacy, emotional resilience, and mind-body integration. So in this way, we can see that how yoga and meditation and breathing exercise can help us to come out from such kind of mental or psychological issues and problems in illness. Now, there are so many researches have already been done. So we can see even on praksha meditation, Dr. Devendra is working from last 10 to 15 years or more than that on praksha meditation, how it can help other people in addressing their problems. Though academic performance is one of the main point of our research at FIU, and we have published almost 7 to 8 good papers out of all these researches. So we will share those studies. Might be I have not posted yet, but I will post it. Now, HRV and vagal tone studies, you can see that also MBSR's researches are also before us, so that we can be convinced that how yoga and meditation can help in this particular problem. And there are several peer-reviewed journals which can also be seen. So in this way, I would like to say that a yoga and meditation is also helpful to address such mental problems and issues. But it is required that how we are practicing all these things seriously and with honesty, with full consistency or regularity. Just a 1 day or 2 day practice do not work. We have to be very consistent in our practice and serious if we want to take benefit of all these things. Clear? So with this, I have, if somebody has any questions, they can ask.
Well, the thing is, Samaniji, can I share an image? Because one thing I haven't presented yet of the mudras benefit in the brain. Maybe I can show you
Yes.
one slide if that's okay. While
Yeah,
looking
it will be good. You can show.
So I did it as an image just because it's easier to sometimes see. So this is a busy slide, but it's not. So this group use Kirtan Yoga, which is basically mudras, but you say sounds like sata. So like Gyan Mudra, say they hold it and say sa. Then Shuni, they do thumb to middle. Then Surya, they do thumb to ring. And they call it slightly different, but it's the same principle. And they did MR, functional MR. What does that mean? That means that you can see how the cells are using fuel and oxygen at the time. And as practitioners started using this, somebody said with consistency, they found very interesting things. That if you did these mudras, you affected key areas of your brain. Like the prefrontal cortex, one that helps you judge and decide. We've already been through it, in depression and anxiety, use this cortex, and we know yoga can help that, meditation. So these mudras do that. And interesting that other function like that, these are very important areas. Your sensory part, hippocampus, which is your able to regulate yourself. And then in the studies, they found changes that are quite impressive in terms of their function connectivity. So in the function MRI, you can see how the brains are interconnected, have different parts, and they have a measure for that. And as you do this, you start seeing, this is a control, you start seeing more interconnectivity. So it's coherent. So the brain's getting more and more coherent. And the default mode network modulation improves, which is important in your, again, your ADHD, your brain functioning. It's kind of your base function that you need. And it showed some evidence in inflammation and neurotransmission. This is just this form of mudras with this sound. So it's chanting and mudra both, but it's no yoga and nothing else. It just shows you how mudras can have of their own quite important effects. So I hadn't a chance to show it anywhere else because we are taught generically, but it's a good visual slide, I think, to kind of cover that. Okay, that's it.
So Devendra bhai, I have a quick question into this one, right? So whenever it is a touch that make those the sensory effect, or it is a pressure?
Touch is touch. Pressures don't need, as somebody will tell you. But in this study, which is the only one I found, they actually did brain areas change. You can see changes when you do this. When you do the touch, but they did with as part of the kirtan, which is chanting. When they did that, each individual one they did, and you do that for time, then do the MRI, they saw that part brain light up and oxygenate. So these are connected to areas of the brain, which kind of we know in general sense, but it's just touch. It's not the pressure, it's connectivity. And then they did it with chanting, so I don't know which part as well. The combination is very powerful. But I think each will be powerful. I'm not suggesting that they wouldn't be. But just show you how important mudras are. I think there is data that are actually more effective, more effective might just think by themselves, they're actually quite effective.
And did you ever try to, it means if we are, however, we are doing the namaste, right? So means the opposite hands is touching to is the same points. And have you ever did that kind of stuff? Means does it get the same impact, or it is just this with this the same hand, or have you tried, or?
This is the only study I've come across where they did. Don't forget, these are very, very difficult studies to do, very expensive, and it's not easy just to do it. You have to have a lot of technology available to do that. So it's kind of why it's hard to do. But the effect was quite strong. Like, it wasn't small. This was a good effect, and the agingness is slowed that down over weeks. Just that. I don't know. This will do the same because different parts of brains that are mapped. You're mapping to brains. I think probably you should stick to what some of you teachers, because it's their map. This is ancient wisdom is mapped to brain. If ancient wisdom said this, would have been fine. It didn't say that because there's something else going on. So I think I wouldn't question it. I just think we're understanding it, and we're understanding why. And imagine mudras are what the Indians did, not acupressure, acupuncture. They also figured out a way without the needles, right? Because it's just as effective. So they're smarter,
Yeah, that was, I was just thinking, because sometimes if we are just pressing, it's created more impact, or just a touching one. So
I think it's touching. It's not pressure. This is touching, is connectivity and awakening the part of the brain. But some of you might elaborate, but I think touching.
Yes, here the touching is more important. And if you pressurize a little bit, maybe if there is some blockages or some displacement of the nerves, etc., then the pressing sometimes may work to deal with the problem, especially. But here the elements are working actually when we are. So touching is enough rather than pressing. But pressing sometimes can work if there is some blockages or some toxins or some displacement or disorder. So to settle that, okay? Or if the energy paths are blocked, so to open them. So pressing sometimes can work. But mostly when we are doing mudras, especially, we are just mixing two elements, okay? Fire element, air element. So to control the air, we need the fire, okay? Or to activate the what we say space element inside, we need this. So the thumb is what we say. It is a what we say. Surya. So it is most powerful part of our hands, and that's why it can be connected with other elements and can be strengthened, that element, with the support of the thumb. So mostly thumb is joined with all other tips of the fingers for balancing, for removing the or if there is deficiency of that particular element, then the thumb is. And you have asked about the fingers, which are the same fingers. So it may be that if the element is imbalance in any part of the body, right or left, if you are putting this way, so it may make balance. Okay, suppose in one part you have enough, but in other part you have some deficiency. But when you aid these same type of fingers with each other, then they can make balance of it. Okay? So maybe this is the reason, or they strengthen each other. But that element gets strengthened by when the two fingers met together. So
and mudra with the chanting is given a better result, right?
Just I have told that the mudras, you don't need any chanting, but yes, the positive affirmations always help you. Okay, when you are doing mantras or when you are doing mudras or doing some exercise, if your mind is having some positive thinking or affirmation with that, addressing your issue, That will help you.
So what is Kirtan
But
Kriya?
main thing is that with full concentration, you have to do that thing.
So Swamiji,
But
what is Kirtan Kriya?
Kirtan Kriya means you are doing some prayer. So that is Kirtan, Stuti. You are singing some song, religious song, or spiritual songs continuously. Okay, in a group. That is Kirtan with some instruments also. So it
In this
happens
way,
in Hare Krishna, Hare Rama temples or everywhere there is Indian temples especially.
here they did Kirtan Kriya, they did those sounds, and
Yes.
they did this.
So yeah,
One
so
group,
there
they
are
did
certain
that.
instruments
They
which
move
are
and
also being
yeah.
used, and it is being done in a group, a big group, and continuously for half an hour, 1 hour, whatever time they one after another they are singing the some or other songs.
It's like jap, except with some mudra.
Yes, yeah. Kirtan is a kind of songs which you are reciting in the praise of the God or in whom you believe.
So probably the mala can help too. You're doing finger with the mala too. Maybe there's something more than just.
Kirtan is a kind of song. See, whenever you might have noted the Mirabai, suppose. So she would have that tambura, and
Yeah.
she is always singing some song on that. That is Kirtan.
Got it. But I wonder if mala.
Same as bhakti.
Mala is the chanting. Actually, it is chanting. Mala doesn't come Kirtan, but it is chanting. When you are reciting some songs in the memory of the God or in the prayer of the God or in devotion of the God. So that is called Kirtan.
The same as bhakti, right, Samaniji?
Yeah, same as bhakti, devotion. Especially in Gurudwara, the Kirtan goes on.
Yeah, different
in
terminology.
Gurudwara, they go. So they use some peti or violin or such kind of instruments with that.
What Bhai was saying is when we do the mantra, then pressing the manka of the mala. So that's mudra, like activating our touch sense at the same time when we're doing mala.
That's what I was trying to say. Yes.
See, it can be said one kind of exercise, but it is not proper mudra actually.
Yeah, no.
Your attention is on mantra, not mudra.
Right.
And it's not closing the circle, right? You're not joining your fingers ever. You got the mala.
So you need to close the circuit. You know that this is electrical.
Yeah, you have to close the circuit for that effect.
Yeah, that's true. That's true. We should be clean and clear cut. Thank you.
But I think, Samaniji, when you do mudras, when you do the mudra and you say you have to be totally focused on doing the mudra, to sit like for 10 minutes and just one mudra and just to sit there, is that easy or is that difficult? I think that might, I don't know. I feel like unless I'm saying something or chanting something in my mind, just sitting in the mudra position would be hard.
It may be hard because our mind doesn't stop easily. So don't worry about that. But if you are doing mudra and something is going in your head, try to concentrate on your practice. But it is not necessary that you can, your mind would be completely concentrated. But don't worry about that. Just to practice mudra, it will work. Okay. If your mind is fully concentrated, you can get more benefit, but it doesn't mean that it will not work. So I'm noticing that whenever you are doing mudras, it is working actually. Mind may be somewhere else sometimes, not only your mind, but our minds also. Okay. So because we are working or thinking, but if we are doing mudra, then it is affecting our body actually.
Okay, just doing it and doing something else at the same time.
Yeah.
See, this same mudra with
but
slow
don't try
breathing.
it that always you are engaged in some other things and you want to take 100% benefit. You have to be serious at least what you are practicing. Okay. It is not necessary that 10 minutes your mind would be completely focused and concentrated. It may wander. Still, it will work.
It will still work. Good. Thank you.
Yes.
So how you can calm down your mind gradually, slowly to bring it on a full concentration?
Yes, just try to see, the positive affirmation can help you, okay, regarding your problem. You have to think that my body is getting cool and calm, or my mind is getting calm and cool. Suppose. So if you need calmness of your mind, then you have to focus on that and make more and more affirmation in that way. So think in that way, in that language. So that will help you.
Positive affirmations. Yeah.
Yes. Or connect yourself with the breathing. That is the most effective way, and to concentrate your mind. Perception of breathing. Try to be more and more in the present what you are practicing. Okay. So several ways you can and see which one is more suitable for you. So done. So you have made all the announcements, Dr. Nana?
Yes, I think so. Does anyone have any questions? I explained what we're doing and how the exam is going to be, and that this is the last lecture. There will be 2 weeks of revision. I think one suggestion with the revision 2 weeks for the multiple choice question, it was actually from Sachi, is that maybe we'll see if we can design some questions that we can give out every day of that week, or once a week or whatever, so they can practice. Like we had the practice questions for the first half of the course. We didn't get any practice questions for the second half of the course. So just to get an idea of what kind of questions there will be. So we'll work on that and make some questions like that and see if we can put some up for the first and second week of the revision.
I did have one more question from one of the announcements earlier. So I know you said the last week before the finals, at like Monday through Thursday every day, that we'll have like short answer questions that we'll do. Will that be like part of our final part of a grade, or just like more practice?
No, it's a grade. It's an exam.
Okay.
That whole week is an exam. So because the exam itself, the multiple choice questions are only going to be on the medical knowledge part of the exam, part of the course, we want to include some short answer questions on the pranayams and the mudras and the mantras, the meditation and the asanas. So the 4 days, one day will be, say, asanas. Second day, Monday will be asanas. Tuesday, I think I put it in the schedule, but we can maybe change it around depending on what Samaniji thinks. But asanas, mudras and meditation is, mudras and mantras are together, and meditation and pranayam, like this, or starting with meditation, pranayam, like this.
Sounds good. Thank you.
Yeah, this time the final exam, so it is not a selective. It means you have to be ready for all the mudras, all the breathing exercise, all the meditations. So whatever questions come before you, you can answer to that. Okay. So, and there are very selected things which you can easily learn, and we have revised so many times already. You have also given so many times the sessions for short time, long time, like this. So already it is into your mind. Just you have to revise that everything should be ready, prepared now, right now. It is not just one or two things you have to prepare. But the whole list of the pranayam must be before you, that what pranayam, what is the technique of that pranayam, what are the benefits of that pranayam, how it is done. Okay. And what are the precautions, what are the what to say, what to say, indications.
Contraindications, yeah.
Yes, so all these things should be in your mind regarding pranayam or mudras or physical exercise or breathing exercise or meditation. But yes, we will take one day. So just you can be focused on one thing at a time.
I think
It
that's
would
better.
not be, it would not be too much for you because there are so many pranayams, so many breathing exercise, and they are not very big things, not the books of the physics or chemistry. Okay, very simple things, so you can easily understand, remember. So you would be
on the
relaxed.
Saturday, on the March 21st Saturday,
Mhm.
there is another exam from 8 to 10, multiple choice.
That's the one.
That's the one. And then the week before is just a practice.
No. 8 to 10 is the multiple choice questions. The week before are the short answer questions. The exam is over the whole week.
Okay, so two different exams.
Yeah, two different. I mean, it's all part of the same exam, but we're just doing the short answer questions we're doing because it would be too long to do a whole exam.
Okay, on Saturday.
Yeah, on Saturday. And Samaniji would like to include some short answer questions. So we just have a few short answers questions, maybe up to like 10, maybe less on each day.
Okay.
Yeah, but the marks are going to go towards the final.
Okay.
The exam short answer questions, the presentation that you're going to be giving on the Saturday, as well as the the short answer question and the MCQ multiple choice. So all together, it's all going to be graded, and then obviously the asanas will have its own grade. Yeah. And then it will combine with the midterm. The midterms were graded as well.
Yeah.
So midterm grades with these grades together will give the final grade.
Yeah. Okay.
Also, because you mentioned the midterm, this question is weeks late. I apologize, but I know for the quizzes, like we had to take them individually and then upload our results. Were we supposed to upload the result to the midterm? Because I remember there wasn't a spot to upload that.
They should have been recorded already.
The midterm exam?
Yeah, I took it for like when it was during that time, but I don't know that I saw a space to upload
Yeah,
it.
actually there wasn't. You're right. It was just the exam.
Okay.
Yeah.
Okay.
Yeah. I think we get the score back though, right?
Yeah.
Are you wondering whether they've seen that you've done it? I think so. I mean, I don't think I uploaded it, so I think it comes up.
Okay, that was it.
That it was taken. Yeah.
You failed, then you get 0. It's okay.
10 weeks later.
Yeah, it's quite. I have to go back and check now. Now that you said that it's in the class, because it tells you when you go into your classwork, or it just tell you if there's anything unfinished. And if you haven't got that as an unfinished thing, then they've obviously got it. I think that's how it works in the class. In the classroom, if you go into your classwork, it'll give you a to-do list, and any things that have been posted that you haven't submitted that they haven't got, it will come up as a to-do.
Will the questionnaire that Dr. Devendra sent, the set of questions?
Yes.
We did that 2-3 weeks ago, the first part. The second part we will do the week before the exam.
If you can do by the weekend before, that'll be great. If you can do them by the weekend before the exam, then we can compile for the final day.
Bring all those papers with us.
Yeah, I think bring them if you want, or after you finish, I'm going to send you an Excel sheet to put your data in. If you think you're capable of that, it'll score it for you automatically.
Okay.
I've got a draft Excel sheet. I'm ready for you to finish both. Then you put it in, they'll score it automatically where you are.
Okay.
Just plug the numbers.
Okay.
And then you can just tell us your numbers. It's your own personal journey. You can just tell us on the day what happened. Okay. And you can maybe present it when we present it on the Sunday afternoon to the group.
Include that in our presentation.
Yeah, for your presentation, even better. Yeah. That would be a good idea.
But we need to have that scoring sheet before then.
Well, the scoring sheet you already have, but if I put the Excel sheet for it, score it for you, because their scoring is a bit quirky. So I'll preset the Excel sheet with the cells. So you just put your numbers and it'll calculate for you.
Yeah.
It's more for that. So then you can your numbers, your sheets, you just put it in there. I've got it, but I'm finding it hard to send you the workbook, but I'll figure out how to do that because I can send you each sheet. But that gives you each variable in different pages, and then it calculates for you. As all Excel do. It's basically resetting it. So that you just have to put the numbers where they belong. and then it'll give you a number and scoring and percent and which changes you had, and even plot it for you, so you can see your change.
Yeah, that'd be great.
Okay. So I think that'll help. But as I said, once you finish, I'll send it to you. Make sure we did that. If you haven't, please do the first, and you still have time to first and second, probably even if it's a short term, because it's more self-journey, but it's interesting to see what happens. I don't know what's going to happen either. So I did it, so we'll see.
Yeah.
Just exercise, and you can use these tools. If you use them yourself, you can use them in the future yourself for others. That's kind of one of the reasons. I have one question, and this is more because Rakesh asked me. I can do it much later, but he asked why we didn't cover, why couldn't we cover dementia and Alzheimer's. And what I could do if there's time is one of those days I could just give you the science part of that, which is all you need, because all the yoga stuff you already know. So I could take that, and then if people want to do that, I can present the data. And in fact, that image was from before. That image is part of that I showed you, because that's kind of how these studies have shown in that setting, cognitive studies. So I could do that probably for half an hour, 40 minutes in one of the sessions next 2 weeks. And then it won't be examined, tested, but just to serve your need, because I know you want to serve that population, then we might as well cover that.
Yeah.
Are we okay with that?
That'd be great.
I think that sounds good.
Okay. There'll be 19 diseases we covered. No, 17. I'm sorry, losing count. And I'll show you Samaniji, and she probably has to contribute to that, I'm sure. So we'll put it together, and then we can present it. There's some Pragyaji then work on dementia also, so I think it's some good work on that.
Thank you.
This has become a big problem to the people, no? Dementia and
Alzheimer's,
Alzheimer's.
I don't know how we missed it. We missed it. It should have been on the list, but he reminded me, so we'll have to fix it now.
Next year's course will include it.
Yeah,
I think
I'll do it
when
quickly,
we
next
left
year
out
we'll
a
do it
couple of things. So
yeah,
there seems like a lot of diseases already that we had, but we can add that many more.
Or otherwise, Devendra Bhai, means next week, whenever we do the 1 hour, this the question answer, after that one, you can take at least 45 minutes on that disease. Just give a glimpse.
No, I will. I think you know enough of it, so I can focus just on the science and the treatment, like the yoga and mudras and stuff, because that's what you want. Because everything else you already know. I think in that setting, we already know those two diseases so well. So just like we didn't cover obesity, you know it. We just told you what to do. No point talking about it because you already know what that is. So this is another one I can just focus on, and then maybe Samaniji can work on some of those. I'll talk to Samaniji, see what we can do together. But that, I think you'll get it because you already know everything. You already know yogas and what to do, and I think it's easy to slip this in. And since you're agreeable, I'll put that together for one of those days.
Thank you.
Thank you. So should we stop here, or meditation is required?
We can stop, Samaniji. We've got
Yes.
we've got practice for the exam tomorrow.
Yeah, we got to do a purchase for test exam. Practice.
Yeah.
No, I need to use a meditation for that. Actually,
Yes. So focus on that. This time meditation is not required.
Or maybe it is.
This is dhyan, but different kind of dhyan.
For exam, you have to just focus on the text, not any other
dharma
things.
dhyan, Samaniji. We're going to do dhyan on the text.
Yes, it is dharma dhyan. It is dharma dhyan. Whenever we try to understand the realities, it is dharma dhyan.
I learned that from Pachis Bowls, Samaniji. I can say that.
Oh, yes. 400 people have registered.
400 now? Oh my goodness. Might be the biggest exam ever.
Yes, 400. Still people are pursuing that we want to appear in the exam. We want to appear in the exam.
Wow.
Really taken off.
Yes.
Wow.
So at least out of 400, 300 must be there in the exam, but maybe all the 400, whatever number is there.
Yes.
That's nice.
So many must be doing online, because I don't know how many will be coming in person. I said most will be online, right? We're not going to have so many in person.
Because it is from India, see?
Yeah,
it's
exactly, from India.
300 people from India are joining, okay? So that's why there is no other way than online exam.
Yeah, exactly, 300, wow. Okay, that's a big group.
Yes, and in USA also from different cities people cannot come.
No,
Yeah, just
exactly.
from Orlando.
So in person
or
is only
it's-
Orlando group. Exactly. So that's going to be not so
No, but
many
that's the
people.
best way to learn. We have the advantage. We should make most of the advantage, right? So in
That's
person
right.
is the best way to learn.
Yeah, so it has created a big momentum among the people.
Sounds like it. Brilliant.
Okay, thank you
It's
very much.
really
Okay,
Wonderful.
Vandami,
Vandami.
Samaniji, thank you.
Wonderful.
Thanks a
Good
lot.
news.
Vandami
Very exciting. Very
Samaniji.
exciting. Okay, well,
Yes.
yeah, Dineshji Vandami. It says
Yeah,
Vandami.
yes,
Did you hear Dineshji say Vandami to Samaniji? Oh, there he
yeah,
is.
Dinesh.
There he
Dinesh.
is.